Phlebotomy Technician Certification Exam Prep. Question 1. Which of the following parameters can cause a false decrease in bilirubin levels if a sample is handled improperly? Option A. Over-isotonic chilling. Option B. Exposure to direct room light or sunlight. Option C. Inverting the tube more than 10 times. Option D. Delays in serum separation beyond 4 hours. The correct answer is option B. Exposure to direct room light or sunlight. Light exposure breaks down bilirubin and can produce falsely decreased results. Specimens for bilirubin testing should be protected from strong light soon after collection. Chilling, inversion count, or routine separation delays do not cause the same light-driven degradation. Question 2. Which of the following tubes contains a clot activator paired with a gel barrier separator? Option A. Gold top, SSD. Option B. Light green top, PSD. Option C. Lavender top. Option D. Light blue top. The correct answer is option A. Gold top, SSD. Gold SST tubes contain a clot activator and gel separator. The clot activator promotes serum formation, and the gel forms a barrier during centrifugation. PSD tubes contain heparin for plasma, while lavender and light blue tubes contain anticoagulants for other testing. Question 3. Which of the following statements is true regarding standard precautions in healthcare settings? Option A. They apply only to patients with known, documented infectious diseases. Option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Option C. They require healthcare workers to wear a full gown and face shield for every routine venipuncture. Option D. They permit the recapping of used needles as long as you use 2 hands. The correct answer is option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Standard precautions require treating all blood and body fluids as potentially infectious. This approach protects healthcare workers and patients regardless of diagnosis or appearance. Selective precautions based on perceived risk misinfections that are unknown or asymptomatic. Question 4. What does the acronym PASS stand for in relation to fire extinguisher operation? Option A. Pull, aim, squeeze, sweep. Option B. Push, aim, slice, secure. Option C. Pull, activate, squeeze, shake. Option D. Press, aim, secure, sweep. The correct answer is option A. Pull, aim, squeeze, sweep. PASS stands for pull, aim, squeeze, and sweep. This sequence describes the basic operation of a portable fire extinguisher. Using the wrong sequence can waste time and reduce effectiveness during a small controllable fire. Question 5. Which of the following situations can lead to a lawsuit charging a phlebotomist with battery? Option A. Drawing blood from a patient who has explicitly refused the procedure. Option B. Making a minor clerical error on a specimen tube label. Option C. Forgetting to wash hands between routine patient encounters. Option D. Accidentally causing a small hematoma during an authorized draw. The correct answer is option A. Drawing blood from a patient who has explicitly refused the procedure. Battery involves unauthorized or offensive physical contact with another person. Drawing blood after a patient has explicitly refused the procedure can meet that definition. Documentation errors, hand hygiene lapses, or authorized complications involve different legal issues. Question 6. Why should a phlebotomist avoid drawing blood from a paralyzed arm? Option A. The veins are too large and prone to exploding. Option B. The lack of muscle movement leads to poor circulation and potential thrombosis. Option C. The patient cannot feel if a nerve is being struck by the needle. Option D. Paralyzed limbs do not contain white blood cells. The correct answer is option B. The lack of muscle movement leads to poor circulation and potential thrombosis. A paralyzed arm may have reduced circulation, impaired sensation, and increased risk of thrombosis or swelling. Specimens from that limb may not reflect normal circulating blood as reliably. Lack of pain sensation can also delay recognition of injury, but poor circulation is the main concern. Question 7. What is the function of the systemic circulatory system? Option A, moving blood exclusively between the heart and the lungs for gas exchange. Option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C, filtering liquid waste products through the nephron beds of the kidneys. Option D, producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B, routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 8. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A, 70 to 99 mg/dl. Option B, 140 to 180 mg/dl. Option C, 200 to 250 mg/dl. Option D, 300 to 350 mg/dl. The correct answer is option A, 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 9. What should a phlebotomist do if they accidentally touch the site after it has been cleansed with alcohol? Option A, proceed with the venipuncture immediately before the site gets contaminated further. Option B, blow on the skin surface to dry any skin oils that transferred. Option C, re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Option D, wipe the needle tip with alcohol before inserting it into the skin. The correct answer is option C, re-cleanse the site completely with a fresh alcohol prep pad and allow it to dry. Touching a cleaned puncture site recontaminates the skin and compromises antisepsis. The site should be cleansed again with a fresh prep pad and allowed to air dry. Wiping the needle or blowing on the skin does not restore a clean field. Question 10. Which of the following additives works by chelating or binding calcium to inhibit the coagulation cascade? Option A, lithium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium fluoride. Option D, ammonium oxalate. The correct answer is option B, ethylenediamine tetracetic acid, EDTA. EDTA chelates calcium, removing a key requirement for activation of the coagulation cascade. This prevents clot formation and preserves whole blood for hematology and selected molecular tests. Heparin prevents clotting through antithrombin rather than calcium chelation. Question 11. What type of transmission occurs when an infectious agent is spread through contaminated food, water, or drugs? Option A, vehicle-borne transmission. Option B, vector-borne transmission. Option C, airborne transmission. Option D, direct contact transmission. The correct answer is option A, vehicle-borne transmission. Vehicle-borne transmission occurs through contaminated food, water, drugs, or other shared substances. The infectious agent is carried by a non-living medium to the host. Vector-borne transmission involves living carriers such as mosquitoes or ticks. Question 12. Hemoconcentration can be caused by which of the following actions? Option A, leaving the tourniquet on for longer than 1 minute. Option B, using a needle that is too small for the vein. Option C, inverting the collection tubes too slowly. Option D, puncturing the skin before the alcohol is dry. The correct answer is option A, leaving the tourniquet on for longer than 1 minute. Prolonged tourniquet application traps blood in the limb and allows fluid to shift out of the vessels. This concentrates cells and analytes, producing hemoconcentration and potentially misleading results. Needle size, tube inversion speed, and wet alcohol cause different specimen problems such as hemolysis or contamination. Question 13. What type of sample is collected during a therapeutic phlebotomy procedure? Option A tiny capillary tube for microhematocrit checking. Option B, a large unit of blood, typically 450 to 500 ml, to treat conditions like polycythemia vera. Option C. A series of 3 blood culture bottles over 24 hours. Option D. An arterial sample for gas analysis. The correct answer is option B. A large unit of blood, typically 450 to 500 ml, to treat conditions like polycythemia vera. Therapeutic phlebotomy removes a large volume of blood, often about 450 to 500 ml, to reduce red cell mass or iron burden. It may be used for conditions such as polycythemia vera or hemochromatosis under provider order. It is different from diagnostic venipuncture, which collects small specimen volumes. Question 14. What does the term homeostasis mean? Option A. The stoppage of blood flow from an injured vessel. Option B. The steady state or dynamic balance of the body's internal environment. Option C. The destruction of old red blood cells in the spleen. Option D. The production of new cellular elements in the bone marrow. The correct answer is option B. The steady state or dynamic balance of the body's internal environment. Homeostasis is the body's dynamic process of maintaining internal stability. It includes regulation of temperature, fluids, pH, glucose, and other physiologic variables. Hemostasis is specifically the stopping of bleeding and is a different term. Question 15. What type of fire extinguisher should be used on an electrical fire occurring in a laboratory centrifuge? Option A, Class A. Option B, Class B. Option C, Class C. Option D, Class D. The correct answer is option C, Class C. Class C extinguishers are used for energized electrical equipment. They are designed to suppress fire without conducting electricity back to the user. Water-based Class A extinguishers can be dangerous on electrical fires. Question 16. Which of the following additives is used to preserve glucose stability by preventing its breakdown by red blood cells? Option A, sodium citrate. Option B, sodium fluoride. Option C, lithium heparin. Option D, ammonium oxalate. The correct answer is option B, sodium fluoride. Sodium fluoride preserves glucose by inhibiting glycolysis in blood cells. This slows cellular consumption of glucose after collection. Citrate, heparin, and oxalate alone do not provide the same glycolysis inhibition. Question 17. Which of the following factors can cause a false decrease in a patient's serum glucose measurement? Option A, separating the serum from the red blood cells within 30 minutes of collection. Option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Option C, transporting the specimen to the laboratory on an ice slurry. Option D, utilizing a gray top tube containing sodium fluoride to collect the sample. The correct answer is option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Glucose can fall falsely when an uncentrifuged specimen sits at room temperature because cells continue to metabolize glucose. This ongoing glycolysis lowers the measured concentration over time. Prompt separation or collection in a fluoride-containing tube helps prevent the decrease. Question 18. Which of the following actions is a violation of proper sharp disposal safety guidelines? Option A, dropping a needle into the sharps box immediately after withdrawal. Option B, pushing down on items inside a full sharps container to make extra room. Option C, disposing of a sharps box when it reaches the indicated full fill line. Option D, placing the sharps container at eye level near the point of use. The correct answer is option B, pushing down on items inside a full sharps container to make extra room. Pressing down on a full sharps container can cause puncture injury and aerosol exposure. Sharps containers should be replaced when they reach the marked fill line. They should be located near the point of use and never overfilled or manually compacted. Question 19. What is the primary medical reason for avoiding dermal punctures on the heel of an infant who has begun walking? Option A, the skin has developed calluses that block capillary action flow. Option B, the child's heel bone is too small to locate accurately. Option C, walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Option D, walking diverts all white blood cells up toward the abdominal cavity. The correct answer is option C. Walking stimulates tissue changes and calluses, and the puncture can cause deep tissue or nerve irritation. Once an infant begins walking, heel tissue becomes thicker and more calloused and is more vulnerable to deep tissue irritation. Heel puncture at that stage can be painful and less reliable for capillary sampling. Finger puncture or another approved method is used according to age and policy. Question 20. Which of the following tests requires a strict chain of custody tracking form to accompany the specimen through collection, processing, and analysis? Option A. Basic Metabolic Panel, BMP. Option B. Forensic Drug Analysis or Paternity Testing. Option C. Therapeutic Drug Monitoring for digoxin. Option D. Blood Culture Tracking for endocarditis. The correct answer is option B. Forensic Drug Analysis or Paternity Testing. Forensic drug analysis and paternity testing require strict chain of custody tracking from collection through analysis. This documentation preserves legal defensibility and proves specimen integrity. Routine clinical tests generally use standard identification and accessioning procedures. Question 21. What type of protective equipment must be worn when performing a venipuncture on a patient with droplet precautions? Option A. An N95 respirator mask and shoe covers. Option B. A standard surgical mask and gloves. Option C. A full-body Tyvek suit and goggles. Option D. No personal protective equipment is required. The correct answer is option B. A standard surgical mask and gloves. Droplet precautions require a surgical mask, and gloves are used for venipuncture under standard precautions. The mask protects mucous membranes from large respiratory droplets during close contact. N95 respirators are reserved for airborne precautions. Question 22. If a phlebotomist notices a hematoma beginning to form during a blood draw, what action should be taken immediately? Option A. Adjust the depth of the needle to stop the swelling. Option B. Remove the tourniquet, withdraw the needle, and apply firm pressure. Option C. Advance the needle further to bypass the hematoma. Option D. Request the patient to pump their fist to redistribute the blood. The correct answer is option B. Remove the tourniquet, withdraw the needle, and apply firm pressure. A developing hematoma means blood is leaking into surrounding tissue, so collection should stop at once. Releasing the tourniquet, withdrawing the needle, and applying firm pressure limits bleeding and tissue damage. Advancing the needle or continuing the draw can enlarge the hematoma and increase patient injury. Question 23. What clinical term describes the liquid portion of a blood specimen that has been allowed to clot completely before centrifugation? Option A. Plasma. Option B. Serum. Option C. Whole blood. Option D. Buffy coat. The correct answer is option B. Serum. Serum is the liquid portion of blood after the sample has clotted completely and been centrifuged. It lacks fibrinogen because fibrin clot formation has already occurred. Plasma is obtained from anticoagulated blood. Question 24. What is the standard depth of a lancet puncture used for a fingerstick on an adult patient? Option A 1.0 to 1.5 mm. Option B 1.8 to 2.4 mm. Option C 3.0 to 4.0 mm. Option D 4.5 to 5.0 mm. The correct answer is option B 1.8 to 2.4 mm. Adult fingerstick lancets generally penetrate about 1.8 to 2.4 mm. This depth reaches the capillary bed while limiting injury to deeper structures. Shallower punctures may not provide adequate flow, and deeper punctures can cause unnecessary trauma. Question 25. Which of the following elements is a primary link in the chain of infection? Option A. The source or reservoir of the pathogen. Option B. The cost of personal protective equipment. Option C. The layout of the outpatient laboratory facility. Option D. The brand of antiseptic wipes used to clean benches. The correct answer is option A. The source or reservoir of the pathogen. A reservoir is a primary link in the chain of infection because it is where a pathogen lives and multiplies. Breaking any link, including reservoir, exit route, transmission, entry route, or susceptible host, helps stop spread. Equipment cost or room layout may influence practice but is not a chain link. Question 26. What should a phlebotomist use to clean a workspace surface that has been contaminated by a blood spill? Option A, 70% isopropyl alcohol. Option B, a 1:10 dilution of sodium hypochlorite, bleach. Option C, plain warm soap and water. Option D, concentrated chlorhexidine solution. The correct answer is option B, a 1:10 dilution of sodium hypochlorite, bleach. Blood spills should be disinfected with an appropriate bleach dilution or approved hospital disinfectant. A 1:10 sodium hypochlorite solution is commonly used because it inactivates many blood-borne pathogens. Soap and water alone remove soil but do not provide adequate disinfection for a blood spill. Question 27. What is the correct order of draw when collecting a blood culture, a chemistry SSD, and a sodium citrate tube using a multisample needle system? Option A, BSST, light blue, blood culture. Option B, blood culture, light blue, SST. Option C, light blue, SST, blood culture. Option D, blood culture, SST, light blue. The correct answer is option B, blood culture, light blue, SST. Blood cultures are drawn first, followed by light blue citrate tubes and then serum tubes such as SST. This sequence protects culture sterility and reduces additive carryover into coagulation specimens. Drawing SST before citrate can introduce clot activator or gel-related contamination risk. Question 28. What type of patient environment requires protective, reverse, isolation protocols? Option A patient with an active, contagious respiratory flu virus. Option B, a patient with an open, draining MRSA wound infection. Option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D, a patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 29. How should a phlebotomist approach a child who needs a blood test? Option A, tell them it will not hurt at all to gain their trust. Option B, explain the procedure in simple, age-appropriate terms and ask for their cooperation. Option C, have 3 guards hold them down before introducing yourself. Option D, show them the largest needle to prove how brave they need to be. The correct answer is option B, explain the procedure in simple, age-appropriate terms and ask for their cooperation. Children cooperate best when the procedure is explained honestly in language they can understand. Asking for cooperation while using calm reassurance promotes trust and reduces fear. Saying it will not hurt or showing an intimidating needle can increase distress and loss of trust. Question 30. What type of consent is required before a phlebotomist can draw blood from a minor child? Option A, implied consent from the child's teacher. Option B, informed or expressed consent from a parent or legally authorized guardian. Option C, no consent is needed as long as a doctor ordered the test. Option D, verbal consent from the minor patient themselves. The correct answer is option B, informed or expressed consent from a parent or legally authorized guardian. A minor generally requires consent from a parent or legally authorized guardian before routine blood collection. The child should still receive age-appropriate explanation and cooperation should be sought when possible. A physician order alone does not eliminate consent requirements. Question 31. Which antiseptic is recommended for a patient undergoing a skin puncture for a blood culture if they are allergic to chlorhexidine? Option A, 70% ethyl alcohol. Option B, povidone. Option C, hydrogen peroxide. Option D, benzalkonium chloride. The correct answer is option B, povidone. Povidone iodine is an appropriate alternative when chlorhexidine cannot be used for blood culture skin preparation. It provides broad antimicrobial activity when applied and allowed to dry according to protocol. Hydrogen peroxide and benzalkonium chloride are not standard substitutes for this purpose. Question 32. Which of the following tests must be kept warm at body temperature during transport to the laboratory? Option A, cryoglobulins. Option B, ammonia. Option C, lactic acid. Option D, free fatty acids. The correct answer is option A, cryoglobulins. Cryoglobulin specimens must be maintained at body temperature until processing because the proteins can precipitate when cooled. Warming prevents premature precipitation that can alter test results. Ice transport is used for analytes such as ammonia or lactic acid, not cryoglobulins. Question 33. What should a phlebotomist do when a multisample vacuum tube fails to fill with blood during a draw? Option A, gently advance or pull back the needle slightly to ensure it is in the lumen. Option B, remove the needle completely and start over on the other arm. Option C, leave the tube in place for 3 minutes to allow the vacuum to recover. Option D, push the needle deeper at a 90-degree angle. The correct answer is option A, gently advance or pull back the needle slightly to ensure it is in the lumen. A vacuum tube that fails to fill may indicate the needle bevel is against the vein wall or not fully in the lumen. A small adjustment forward or backward can restore flow without unnecessary reinsertion. Pushing deeply or waiting for the vacuum to recover can injure tissue and waste time. Question 34. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A, draw the blood anyway and ask the patient to state their name. Option B, look for the ID band on the nightstand or 4-pole and scan it. Option C, refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D, verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C, refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bed rail, or 4-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 35. What should a phlebotomist do if they encounter a patient who does not speak the same language as the healthcare provider? Option A, use hand gestures to explain the invasive procedure and proceed with the draw. Option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Option C, ask the patient's roommate to translate the instructions for you. Option D, cancel the test order and document the patient as uncooperative. The correct answer is option B. Enlist the services of a certified medical interpreter to ensure proper communication and consent. Certified medical interpreters ensure that the patient receives accurate information and can provide meaningful consent. Family members or untrained staff may omit, alter, or misunderstand medical details. Clear communication is essential for safety, cooperation, and legal compliance. Question 36. What color top tube contains the additive EDTA and is used for molecular diagnostic testing and viral load checks? Option A, PAL/white top with gel barrier. Option B, light blue top. Option C, gray top. Option D, yellow top with SPS. The correct answer is option A, PAL/white top with gel barrier. PAL or white top tubes commonly contain EDTA with a gel barrier for molecular diagnostic tests such as viral load testing. EDTA helps preserve nucleic acid stability and prevents clotting. Light blue, gray, and yellow SPS tubes serve coagulation, glucose, or culture-related purposes. Question 37. What is the primary function of the anticoagulant EDTA? Option A, it enhances the action of thrombin. Option B, it binds calcium ions, preventing the clotting cascade from activating. Option C, it destroys white blood cells to preserve red cells. Option D, it stabilizes glucose levels by stopping cellular glycolysis. The correct answer is option B, it binds calcium ions, preventing the clotting cascade from activating. EDTA binds calcium ions and prevents the coagulation cascade from progressing. This preserves whole blood for hematology testing and maintains cell morphology. It does not preserve glucose or accelerate clotting. Question 38. Which of the following statements matches the correct definition of assault? Option A. Unjustified or unconsented physical contact with another person. Option B. The intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C. Revealing confidential medical findings to unauthorized personnel. Option D. Mislabeling a laboratory specimen tube by accident. The correct answer is option B. The intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 39. What is the main reason for avoiding blind probing or sweeping when attempting to locate a vein? Option A. It breaks the vacuum seal of the multisample tube. Option B. It can cause permanent damage to underlying nerves and blood vessels. Option C. It dulls the needle tip and makes skin entry painful. Option D. It causes the patient's blood pressure to spike excessively. The correct answer is option B. It can cause permanent damage to underlying nerves and blood vessels. Blind probing or sweeping moves the needle through tissue without knowing where the tip is. This can damage nerves, arteries, tendons, and surrounding soft tissue. If blood flow is not obtained with minor adjustment, the attempt should be stopped and reassessed. Question 40. Which of the following elements can cause a falsely elevated calcium level during a venipuncture? Option A. Prolonged tourniquet application past 2 minutes. Option B. Chilling the specimen on an ice slurry. Option C. Using a 21-gauge needle on a large vein. Option D. Failing to wipe away the first drop of blood during a finger stick. The correct answer is option A. Prolonged tourniquet application past 2 minutes. Prolonged tourniquet application can concentrate proteins and protein-bound analytes, including calcium. This may create falsely elevated calcium results. Chilling, normal needle size, or capillary first drop handling do not cause the same venous stasis effect. Question 41. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option A. Light blue top. Option B. Lavender top. Option C. Gray top. Option D. Green top. The correct answer is option C. Gray top. Gray tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing gray tubes too early increases additive carryover risk. Question 42. What is the clinical term for a state of fainting or temporary loss of consciousness caused by a sudden drop in blood pressure? Option A. Syncope. Option B. Shock. Option C. Vertigo. Option D. Hemostasis. The correct answer is option A. Syncope. Syncope is a temporary loss of consciousness caused by reduced blood flow to the brain, often from a sudden blood pressure drop. It may occur during venipuncture due to anxiety, pain, fasting, or vasovagal response. Shock and vertigo are different clinical conditions. Question 43. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A. The posterior curvature of the heel directly over the calcaneus bone. Option B. The medial or lateral margins of the plantar surface of the heel. Option C. The central arch area of the foot pad. Option D. The tips of the smaller toes. The correct answer is option B. The medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 44. What is the primary purpose of the laboratory safety data sheets, SDS? Option A. To track the daily attendance and performance records of employees. Option B. To provide detailed information regarding chemical hazards, handling, and first aid measures. Option C. To schedule the preventative maintenance routines for centrifuge machines. Option D. To log the critical panic values reported to physicians. The correct answer is option B. To provide detailed information regarding chemical hazards, handling, and first aid measures. Safety data sheets provide essential information about chemical hazards, safe handling, storage, spill response, and first aid. They support employee safety and emergency response in the laboratory. They do not track attendance, equipment schedules, or critical value reporting. Question 45. What should a phlebotomist do immediately after activating the safety device on a used venipuncture needle? Option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. Option B. Drop the needle into a biohazard waste bag with blood-stained gauze. Option C. Set the needle down on the patient's bedside table until the tubes are fully labeled. Option D. Detach the needle from the tube holder adapter and place only the needle into the sharps container. The correct answer is option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. After the safety device is activated, the used needle assembly should go directly into a rigid, leak-proof sharps container near the point of use. Immediate disposal minimizes handling and needle stick risk. Needles should not be recapped, carried around, or placed in regular trash. Question 46. Which of the following tubes contains an additive that preserves cellular morphology for a differential blood smear? Option A. Light blue top. Option B. Lavender top, EDTA. Option C. Gray top. Option D. Green top. The correct answer is option B. Lavender top, EDTA. Lavender EDTA tubes preserve cellular morphology for differential counts and blood smears. EDTA prevents clotting without causing major distortion of white blood cell appearance when smears are prepared promptly. Citrate, fluoride, and heparin tubes are not preferred for routine differential morphology. Question 47. What constitutes a proper unique identifier sequence for an inpatient according to the Joint Commission? Option A. Full name and room number. Option B. Full name and date of birth. Option C. Attending physician and bed number. Option D. Date of birth and diagnosis. The correct answer is option B. Full name and date of birth. Two reliable identifiers are required to link the specimen to the intended patient. Full name and date of birth are acceptable because they identify the person rather than the location. Room number, bed number, diagnosis, or physician name can change and should not be used as primary identifiers. Question 48. Which of the following factors can lead to hemoconcentration during a blood draw? Option A. Releasing the tourniquet as soon as blood flow is established. Option B. Allowing the patient to pump their fist repeatedly and forcefully. Option C. Positioning the patient's arm downward during the procedure. Option D. Using a large bore needle on a deep, patent vein. The correct answer is option B. Allowing the patient to pump their fist repeatedly and forcefully. Forceful or repeated fist pumping during tourniquet application increases local muscle activity and venous stasis. This can concentrate analytes and falsely elevate potassium or other chemistry values. The patient may make a fist, but continuous pumping should be avoided. Question 49. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option A. 1.0 mm. Option B. 2.0 mm. Option C. 3.0 mm. Option D. 4.0 mm. The correct answer is option B. 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 50. Which of the following options defines the proper site for an adult capillary puncture? Option A. The thumb or index finger of the dominant hand. Option B. The lateral or medial plantar surface of the heel. Option C. The palmar surface of the distal segment of the middle or ring finger. Option D. The side of the pinky finger near the cuticle. The correct answer is option C, the palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 51. What is the proper angle of insertion when using a winged infusion set, butterfly needle, to draw from a hand vein? Option A, 5 to 10 degrees. Option B, 10 to 15 degrees. Option C, 30 to 45 degrees. Option D, 60 to 90 degrees. The correct answer is option B, 10 to 15 degrees. A butterfly needle is inserted at a lower angle, often about 10 to 15 degrees, especially for superficial hand veins. The shallow angle helps enter small veins without puncturing through them. Steeper angles are more likely to cause infiltration or injury in hand veins. Question 52. What is the proper clinical intervention if a hematoma forms rapidly under the skin while you are drawing a patient's blood? Option A, press down hard on the needle to flatten out the swelling. Option B, release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Option C, switch to a larger vacuum tube to pull the pooled blood out of the tissue. Option D, continue the draw until all ordered tubes are filled completely. The correct answer is option B. Release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Rapid hematoma formation means blood is escaping into tissue during the draw. The tourniquet should be released, the needle removed, and firm pressure applied to stop the bleeding. Continuing the collection or trying to drain the swelling through the tube can worsen injury. Question 53. What type of vessel links the smallest arterial pathways with the smallest venule pathways? Option A, capillary. Option B, sinusoid. Option C, lymph duct. Option D, deep artery. The correct answer is option A, capillary. Capillaries connect arterioles and venules and provide the main exchange surface between blood and tissues. Their thin walls allow movement of gases, nutrients, and wastes. Arteries and lymph ducts perform different transport functions. Question 54. What is the target population for a GO3 card or newborn screening test panel? Option A, geriatric outpatients in nursing homes. Option B, infants up to a few days or weeks old. Option C, pregnant women in their first trimester. Option D, patients undergoing active chemotherapy treatments. The correct answer is option B, infants up to a few days or weeks old. GO3 cards and newborn screening panels are designed for infants shortly after birth. They screen for metabolic, endocrine, and genetic conditions that benefit from early detection. Adult, prenatal, or oncology testing uses different screening methods. Question 55. Which of the following tests is part of a routine liver function panel? Option A, creatinine. Option B, alanine aminotransferase, ALT. Option C, hemoglobin A1c. Option D, troponin I. The correct answer is option B, alanine aminotransferase, ALT. ALT is a liver-associated enzyme included in routine liver function evaluation. It helps assess hepatocellular injury when interpreted with other liver markers. Creatinine, HbA1c, and troponin are associated with kidney function, glucose control, and cardiac injury rather than a standard liver panel. Question 56. Which of the following veins runs along the lateral, outer, aspect of the antecubital fossa and is considered the second choice for venipuncture? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, axillary vein. The correct answer is option B, cephalic vein. The cephalic vein runs along the lateral, thumb side aspect of the antecubital area. It is often considered after the median cubital vein because it may be less anchored or harder to access. The basilic vein is medial and closer to major nerves and arteries. Question 57. A serum separator tube, SST, contains an additive that assists in what process? Option A, preventing coagulation. Option B, accelerating coagulation. Option C, inhibiting glycolysis. Option D, preserving blood cultures. The correct answer is option B, accelerating coagulation. Serum separator tubes contain a clot activator that speeds the formation of a clot before centrifugation. After clotting, the gel barrier separates serum from blood cells during spinning. Anticoagulants prevent clotting, so they would not produce serum in the same way. Question 58. Which of the following items is classified as a biohazard and must be disposed of in a rigid sharps container? Option A clean, unused plastic tube holder. Option B, a blood-soaked gauze pad. Option C, a used lancet device from a heel stick. Option D, the paper backing from an adhesive bandage. The correct answer is option C, a used lancet device from a heel stick. A used lancet is a contaminated sharp and must be placed in a rigid sharps container. Sharps disposal prevents puncture injury and blood-borne pathogen exposure. Gauze may be biohazardous if saturated, but it does not belong in a sharps container unless it contains a sharp. Question 59. What should the phlebotomist do immediately before applying a bandage to a venipuncture site? Option A, check the site to confirm that active bleeding has completely stopped. Option B, ask the patient to bend their elbow firmly over the gauze pad. Option C, apply a generous layer of antibiotic ointment to the wound. Option D, label the tubes using the patient's bedside charts. The correct answer is option A, check the site to confirm that active bleeding has completely stopped. The puncture site must be checked to confirm bleeding has stopped before a bandage is applied. Bandaging over active bleeding can hide continued blood loss and increase bruising. Bending the elbow can also promote hematoma formation and should not be used as pressure technique. Question 60. Which vein is considered the first choice for venipuncture in the antecubital fossa? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option C, median cubital vein. The median cubital vein is usually preferred because it is large, well anchored, and less likely to roll. It also lies farther from major nerves and arteries than the basilic vein. The cephalic vein can be used when necessary, but it is often less stable and more difficult to access. Question 61. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A, draw the blood quietly without waking them up to minimize pain. Option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C, skip the patient and mark them as unavailable on the computer. Option D, ask the patient's roommate to confirm their identity for you. The correct answer is option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 62. Which of the following parameters can cause a false elevation in a patient's white blood cell count? Option A, collecting the sample while the patient is crying intensely or under extreme stress. Option B, chilling the specimen on an ice slurry before transport. Option C, protecting the collection tube from direct artificial room lights. Option D, allowing the serum to sit on the cells for more than 2 hours. The correct answer is option A, collecting the sample while the patient is crying intensely or under extreme stress. Extreme stress, crying, or intense physical exertion can temporarily elevate the white blood cell count. Stress hormones can shift leukocytes into circulation and make the value appear higher. Specimen chilling or light protection does not produce this physiologic leukocytosis. Question 63. What is the primary medical reason for avoiding the basilic vein for routine venipuncture procedures whenever possible? Option A, the vein is too small to yield an adequate sample volume. Option B, the vein is located in close anatomical proximity to the brachial artery and the median nerve. Option C, the vein has a high tendency to collapse under normal vacuum tube pressure. Option D, the vein lacks a sufficient path to the superior vena cava system. The correct answer is option B. The vein is located in close anatomical proximity to the brachial artery and the median nerve. The basilic vein is avoided for routine draws because it lies close to the brachial artery and median nerve. Injury in that area can cause significant bleeding or nerve symptoms. Safer veins should be selected first whenever they are available. Question 64. Which of the following scenarios describes the correct patient preparation for an oral glucose tolerance test, OGTT? Option A. The patient should eat a low-carbohydrate diet for 3 days prior to the test. Option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. Option C. The patient should exercise vigorously right before drinking the glucose solution. Option D. The patient can drink black coffee or tea during the hours of the testing period. The correct answer is option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. An OGTT begins with a fasting baseline specimen, usually after 8 to 12 hours without caloric intake. Food, coffee, or strenuous exercise can alter glucose metabolism and invalidate the test. A low-carbohydrate diet before testing can also distort the response to the glucose load. Question 65. What type of fluid is obtained during a lumbar puncture procedure? Option A. Pleural fluid. Option B. Synovial fluid. Option C. Cerebrospinal fluid, CSF. Option D. Peritoneal fluid. The correct answer is option C. Cerebrospinal fluid, CSF. A lumbar puncture obtains cerebrospinal fluid from the subarachnoid space. CSF surrounds the brain and spinal cord and is tested for infection, bleeding, malignancy, and other neurologic conditions. Pleural, synovial, and peritoneal fluids come from different body cavities. Question 66. What color top tube contains the additive EDTA and is the primary tube used for a complete blood count, CBC? Option A. Lavender top. Option B. Light blue top. Option C. Green top. Option D. Gray top. The correct answer is option A. Lavender top. Lavender tubes contain EDTA and are the primary tubes for CBC testing. EDTA prevents clotting while preserving blood cells for accurate counts. Serum or heparin tubes do not provide the standard specimen required for routine CBC analysis. Question 67. Which of the following tubes contains an additive that prevents clotting by activating antithrombins? Option A. Light blue top, sodium citrate. Option B. Green top, heparin. Option C. Lavender top, EDTA. Option D. Gray top, potassium oxalate. The correct answer is option B. Green top, heparin. Heparin prevents clotting by activating antithrombin, which inhibits thrombin and other clotting factors. Green top tubes use this mechanism for plasma chemistry and selected special tests. EDTA and citrate work by binding calcium rather than activating antithrombin. Question 68. Which of the following conditions can cause a specimen to be rejected due to hemolysis? Option A. Using a needle with a large lumen, such as an 18-gauge needle. Option B. Drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Option C. Inverting a serum separator tube gently 5 times after collection. Option D. Centrifuging a completely clotted serum tube for 10 minutes. The correct answer is option B. Drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Drawing through a hematoma or pulling a syringe plunger too forcefully can rupture red blood cells. Hemolysis releases intracellular contents and may lead to specimen rejection or false chemistry results. Gentle inversion and proper clotting before centrifugation help protect specimen integrity. Question 69. Which of the following tests requires a 24-hour urine collection? Option A. Culture and sensitivity, C&S. Option B. Creatinine clearance. Option C. Routine chemical urinalysis. Option D. Pregnancy HCG confirmation. The correct answer is option B. Creatinine clearance. Creatinine clearance testing often requires a 24-hour urine collection to measure renal clearance over time. The timed urine result is usually paired with a blood creatinine level. Routine urinalysis, pregnancy testing, and cultures use different urine collection methods. Question 70. What type of legal charge can be filed if a phlebotomist discloses a patient's private medical details to a neighbor? Option A, assault. Option B, battery. Option C, invasion of privacy or breach of confidentiality. Option D, negligence. The correct answer is option C, invasion of privacy or breach of confidentiality. Sharing a patient's private medical details with a neighbor is a breach of confidentiality and invasion of privacy. Health information may be disclosed only for authorized treatment, payment, operations, or with proper permission. Assault and battery involve threats or touching rather than privacy violations. Question 71. If a phlebotomist notes that a patient has an active hematoma in the right antecubital area, where should they draw blood? Option A, distal to, below, the hematoma in the right arm, or use the left arm. Option B, directly through the center of the active hematoma swelling. Option C, proximal to, above, the hematoma on the upper right arm. Option D, from the foot on the same side as the hematoma. The correct answer is option A, distal to, below, the hematoma in the right arm, or use the left arm. An active hematoma contains pooled blood outside the vessel and should not be punctured. The opposite arm is preferred, or a site distal to the hematoma may be used if appropriate and permitted. Drawing through the swelling can contaminate the sample and worsen bruising. Question 72. What occurs during the pre-analytical phase of laboratory operations? Option A, running standard controls on a chemistry profile machine. Option B, all processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. Option C, interpreting a bone marrow biopsy under a microscope. Option D, transmitting final electronic medical record entries to billing. The correct answer is option B, all processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. The pre-analytical phase includes everything that happens before actual testing, including orders, patient identification, collection, handling, and transport. Many laboratory errors occur in this phase because specimen quality is established before analysis begins. Analyzer operation and result reporting belong to later phases. Question 73. What type of hazard does the blue quadrant of the NFPA 704 diamond represent? Option A, flammability hazard. Option B, reactivity hazard. Option C, health hazard. Option D, special or specific hazard. The correct answer is option C, health hazard. The blue quadrant of the NFPA 704 diamond represents health hazard severity. It communicates the potential for harm from exposure to the material. Red indicates flammability, yellow indicates instability, and white is used for special hazards. Question 74. Which of the following tests is used to monitor a patient's heparin therapy? Option A, prothrombin time, patient. Option B, activated partial thromboplastin time, APTT. Option C, hemoglobin or 1C. Option D, rheumatoid factor, RF. The correct answer is option B, activated partial thromboplastin time, APTT. APTT evaluates the intrinsic pathway and is commonly used to monitor unfractionated heparin therapy. Heparin affects clotting factors measured by this pathway. Patient is more associated with warfarin monitoring, while HbA1c and rheumatoid factor are unrelated to heparin dosing. Question 75. Which of the following tests evaluates the extrinsic coagulation pathway and is commonly monitored in patients taking oral warfarin therapy? Option A, activated partial thromboplastin time, APTT. Option B, prothrombin time / international normalized ratio, patient / INR. Option C, bleeding time determination. Option D, complete blood count, CBC. The correct answer is option B, prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic pathway and are commonly used to monitor oral warfarin therapy. Warfarin affects vitamin K-dependent clotting factors that influence this test. APTT is used more often for heparin therapy and the intrinsic pathway. Question 76. Which tube is typically utilized to collect samples for blood bank cross-matching and typing? Option A, pink top, EDTA, or plain red top. Option B, light blue top, sodium citrate. Option C, gray top, sodium fluoride. Option D, green top, sodium heparin. The correct answer is option A, pink top, EDTA, or plain red top. Blood bank typing and cross-matching commonly use EDTA pink top tubes or plain red top tubes depending on facility requirements. EDTA preserves red cell antigens and prevents clotting for many immunohematology procedures. Citrate, fluoride, and heparin tubes are used for other testing categories. Question 77. What should a phlebotomist do if they encounter an aggressive, uncooperative psychiatric patient accompanied by an order for blood work? Option A, enlist colleagues to restrain the patient by force without nursing guidance. Option B, postpone the draw and consult with the nurse in charge of the patient's care. Option C, attempt to draw blood while the patient is asleep. Option D, cancel the test order permanently on your own authority. The correct answer is option B, postpone the draw and consult with the nurse in charge of the patient's care. An aggressive or uncooperative psychiatric patient requires a safety-focused pause and coordination with nursing staff. The care team can determine whether the draw should be delayed, supported, or handled under a specific behavioral plan. Drawing while the patient sleeps or using force without guidance creates serious safety and legal risks. Question 78. Which of the following procedures describes the correct method for transporting an ammonia specimen to the laboratory? Option A, keep the tube warm inside an incubator at 37 degrees Celsius. Option B, place the tube immediately into an ice and water slurry to chill it completely. Option C, wrap the tube tightly in heavy foil to prevent any exposure to room lights. Option D, maintain the tube at a room temperature of exactly 25 degrees Celsius. The correct answer is option B. Place the tube immediately into an ice and water slurry to chill it completely. Ammonia specimens must be chilled promptly in an ice and water slurry and transported quickly. Delayed or warm handling can allow ammonia levels to rise in the specimen. Light protection and warm incubation are used for different tests. Question 79. What type of vessel contains thick, muscular walls and carries blood away from the heart under high pressure? Option A, vein. Option B, artery. Option C, capillary. Option D, venule. The correct answer is option B, artery. Arteries have thick, muscular, elastic walls that carry blood away from the heart under pressure. This structure allows them to tolerate pulsatile pressure generated by ventricular contraction. Veins return blood at lower pressure and often contain valves. Question 80. What is the maximum acceptable delay time for separating serum or plasma from cells for most routine chemistry tests? Option A, 30 minutes. Option B, 2 hours. Option C, 4 hours. Option D, 8 hours. The correct answer is option B, 2 hours. For many routine chemistry tests, serum or plasma should be separated from cells within about 2 hours. Delayed separation allows cells to consume glucose and release or exchange analytes. Excessive delay can produce inaccurate results even if the collection itself was successful. Question 81. Which of the following items is the preferred antiseptic for cleaning a site prior to performing an arterial blood gas (ABG) draw? Option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Option B, plain sterile water. Option C, diluted hydrogen peroxide solution. Option D, sodium hypochlorite spray. The correct answer is option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Arterial puncture sites require strong antisepsis because the procedure is deeper and carries higher complication risk than routine venipuncture. Alcohol followed by chlorhexidine or povidone iodine is commonly used according to policy. Sterile water, peroxide, or bleach sprays are not appropriate skin antiseptics for ABG collection. Question 82. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A, hematology. Option B, microbiology. Option C, clinical chemistry. Option D, blood bank. The correct answer is option C, clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry, hematology, microbiology, and blood bank perform different categories of testing. Question 83. What clinical term describes a systemic infection caused by pathogenic microorganisms or their toxins circulating in the bloodstream? Option A, hematoma. Option B, sclerosis. Option C, septicemia. Option D, petechiae. The correct answer is option C, septicemia. Septicemia is a systemic bloodstream infection caused by pathogenic microorganisms or their toxins. It is clinically serious because organisms and inflammatory mediators circulate throughout the body. Hematoma, sclerosis, and petechiae describe local bleeding or vessel conditions rather than systemic infection. Question 84. What does the term basal state refer to in clinical laboratory testing? Option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B, the physical state of the body directly following a heavy workout session. Option C, the point of highest metabolic activity in the afternoon. Option D, the body state while under heavy psychological stress. The correct answer is option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 85. Which of the following parameters is evaluated when checking a patient's prothrombin time? Patient. Option A, the functional capacity of platelets to adhere to vessel linings. Option B, the extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Option C, the total count of circulating red blood cells per microliter. Option D, the efficiency of the kidney to filter out waste urea molecules. The correct answer is option B, the extrinsic pathway of the coagulation cascade and warfarin's therapeutic impact. Patient evaluates the extrinsic and common coagulation pathways and is commonly reported with INR. It is especially useful for monitoring warfarin therapy. Platelet function, red cell counts, and kidney filtration are assessed with different tests. Question 86. Which of the following options describes a pre-analytical error that can occur in phlebotomy? Option A, miscalibrating an automated glucose analyzer machine. Option B, misidentifying a patient or mislabeling a specimen collection tube at the bedside. Option C, delaying the entry of finalized lab results into the electronic medical record. Option D, misinterpreting a cellular structure under a microscope. The correct answer is option B, misidentifying a patient or mislabeling a specimen collection tube at the bedside. Misidentifying a patient or mislabeling a tube occurs before the sample is analyzed, making it a pre-analytical error. These errors are especially dangerous because the laboratory may produce a technically valid result on the wrong specimen. Analyzer calibration and final reporting occur in later phases. Question 87. Which of the following factors is a major cause of specimen rejection in the laboratory? Option A, collecting a lavender top tube for a CBC test. Option B, submitting an underfilled light blue coagulation tube. Option C, delivering a chemistry specimen to the lab within 4 to 5 minutes. Option D, affixing a handwritten label over a pre-printed barcode label. The correct answer is option B, submitting an underfilled light blue coagulation tube. Underfilled light blue coagulation tubes are a common cause of specimen rejection because the blood-to-citrate ratio is invalid. Excess citrate can alter clotting times and make results unreliable. Proper tube fill is more critical for citrate tubes than for many serum or EDTA tubes. Question 88. Which of the following variables can cause a specimen to appear cloudy or milky white after centrifugation? Option A, high levels of lipids, fats, circulating in the blood. Option B, extensive hemolysis from using a small needle. Option C, elevated levels of direct and indirect bilirubin. Option D, failure to mix an anticoagulant tube after drawing. The correct answer is option A. High levels of lipids, fats, circulating in the blood. High circulating lipid content produces a cloudy or milky serum or plasma appearance after centrifugation. This condition is called lipemia and may interfere with optical laboratory methods. Hemolysis creates red discoloration, while icterus creates yellow discoloration. Question 89. Which of the following conditions is an example of an autoimmune or hematological test commonly drawn in a lavender tube? Option A. Prothrombin time, patient. Option B. Erythrocyte sedimentation rate, ESR. Option C. Basic metabolic panel, BMP. Option D. Blood culture series. The correct answer is option B. Erythrocyte sedimentation rate, ESR. ESR is commonly collected in an EDTA tube because the test evaluates red cell settling in anticoagulated blood. Lavender tubes preserve cellular components and prevent clotting. Coagulation and chemistry tests require different tubes and additives. Question 90. If a phlebotomist encounters an outpatient who is hyperventilating and trembling with severe anxiety before a draw, what should they do? Option A. Proceed immediately to get the draw over with quickly. Option B. Instruct the patient to take slow, deep breaths and offer reassurance. Option C. Reschedule the test for a different week. Option D. Administer a sedative if available in the room. The correct answer is option B. Instruct the patient to take slow, deep breaths and offer reassurance. Severe anxiety and hyperventilation should be addressed before attempting venipuncture. Calm reassurance and slow breathing can reduce the risk of syncope, movement, or panic during the draw. Proceeding quickly or administering medication is not appropriate for a phlebotomist. Question 91. What should a phlebotomist do if an inpatient's door is closed and a sign states "No visitors, see nurse" before entering? Option A. Knock loudly, open the door, and walk right in to maintain efficiency. Option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Option C. Skip the patient and come back at the end of the shift without checking in. Option D. Call the patient's room phone from the hallway to ask if it is okay to enter. The correct answer is option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Assign directing staff to see the nurse may indicate isolation, safety, behavioral, or procedure restrictions. The phlebotomist should check with the assigned nurse before entering. Entering without clarification can endanger the patient, staff, or specimen collection process. Question 92. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B. The blood flow will stop completely due to arterial vasoconstriction. Option C. The platelet count will become falsely elevated beyond high limits. Option D. The glucose values will drop to zero within seconds. The correct answer is option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 93. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A. Routine cholesterol screen. Option B. Workplace drug testing. Option C. Blood culture for endocarditis. Option D. Complete blood count for anemia. The correct answer is option B. Workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 94. What is the standard ratio of blood to anticoagulant additive in a green top tube? Option A. 9:1. Option B. 4:1. Option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Option D. 1:1. The correct answer is option C. There is no strict ratio as long as the tube contains enough anticoagulant to prevent clotting. Green top heparin tubes do not depend on a strict blood-to-additive ratio like light blue citrate tubes. The tube should still be filled adequately and mixed gently so enough heparin is present to prevent clotting. Coagulation citrate specimens are the classic ratio-sensitive collection. Question 95. What does the term lipemia describe? Option A high concentration of broken red blood cells giving serum a red tint. Option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Option C, a dark yellow or amber tint in serum caused by elevated bilirubin levels. Option D, a clear, watery fluid component lacking any cellular proteins. The correct answer is option B, a milky or cloudy appearance of serum or plasma caused by high lipid or fat content. Lipemia describes a cloudy or milky serum or plasma appearance caused by high lipid content. It commonly follows recent fatty meals or certain metabolic conditions. Hemolysis appears red or pink, while icterus appears yellow to amber. Question 96. Which of the following is considered an acceptable site for venipuncture if antecubital veins are unavailable? Option A, the dorsal aspect of the wrist. Option B, the dorsal aspect of the hand. Option C, the anterior aspect of the foot. Option D, the saphenous vein in the ankle. The correct answer is option B, the dorsal aspect of the hand. Dorsal hand veins are an acceptable alternate site when antecubital veins are unavailable. They are more superficial but may require a smaller needle and careful anchoring. Wrist, foot, and ankle sites carry greater risk and often require special approval. Question 97. Which of the following blood components is responsible for the initiation of the coagulation process? Option A, erythrocytes. Option B, leukocytes. Option C, thrombocytes. Option D, hemoglobin. The correct answer is option C, thrombocytes. Thrombocytes, also called platelets, initiate primary hemostasis by adhering and aggregating at sites of vessel injury. They help form the initial platelet plug before the coagulation cascade stabilizes the clot. Red cells carry gases, and white cells primarily defend against infection. Question 98. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A, the blood is typically dark red or maroon. Option B, the blood will pulse spontaneously into the syringe. Option C, a tourniquet must be applied extremely tight. Option D, the angle of needle insertion is 15 degrees. The correct answer is option B, the blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 99. If a phlebotomist notices that a patient's name on an ID band matches the requisition, but the medical record numbers are different, what should they do? Option A, draw the specimen and cross out the number on the tube label. Option B, proceed with the draw as long as the alphabetical spelling of the name is correct. Option C, do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Option D, ask the patient which number is the correct one to use. The correct answer is option C, do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Matching names are not enough when medical record numbers conflict. The specimen must not be collected until the discrepancy is resolved by appropriate staff. Asking the patient to choose a number or editing labels manually can create a serious identification error. Question 100. Which of the following is an example of an engineering control designed to reduce the risk of needle stick injuries? Option A, wearing a laboratory coat. Option B, utilizing self-sheathing safety needles. Option C, hand washing after every procedure. Option D, disposing of waste in a biohazard trash bag. The correct answer is option B, utilizing self-sheathing safety needles. Engineering controls are built-in safety devices that reduce exposure risk by design. Self-sheathing or safety-engineered needles help prevent needle stick injuries after use. Lab coats and hand hygiene are work practice or PPE measures, not engineering controls.